Stephen Donnelly, Fianna Fáil spokesperson for health. Roisin Shartel, Social Democrats. Alan Kelly, Labour Party health spokesperson. Louise O'Reilly, Sinn Féin. Catherine Martin with the Green Party. Thank you very much, Richard. Thank you, Minister, for meeting us. The overcrowding in our hospitals has never been worse. What would you do? What policies would you introduce?
First of all, we need to reduce the number of patients coming into emergency departments. That means funding GP practices, a new GP contract.
We think we need to reopen beds.
Urgent action needs to be taken to free up all possible facilities and also to ensure that the greatest number of staff are available.
Resource the emergency departments properly.
I think ultimately we have to ease the pressure in our hospitals, and that means we have a lot of patients there that could be better served in communities settings, in primary care settings.
Number 3 obviously is make sure the beds are in place. So 5 million home care hours will go a long way to reducing delayed discharge.
Where it makes no sense whatsoever that at any one time there's up to 700 people ready to go home or to step down facilities.
Hire staff, specifically hire nurses, doctors, allied health professionals.
The volume of nurses there simply isn't acceptable. That in tangent with the recruitment ban shows really the pressure that has been put on nurses.
We will have a fully costed, fully funded plan to deliver 5,000 more nurses.
A critical part of that is also to establish pay equality for those who are now currently being paid less because they came in after an arbitrary threshold of 2012.
So we need to put money into home care and proper home care packages, and also in relation to step down beds, and we're seeing the opposite of that happening at the moment.
We would also set targets for the conversion of agency staff into directly employed staff and use the money saved to employ more staff.
We need more beds in the public health service. We need more beds for care of the elderly.
But ultimately, I do think we need more staff. We need more nurses. We need more midwives, more doctors, healthcare assistants and diagnostics. So it's a combination of the two. In the short term, it's about more staff. In the long term, it's about funding and implementing the staunch care model.
With a recruitment embargo, how do you recruit nurses? Would you remove the embargo on recruitment?
We would lift the recruitment ban. We would make sure that all the hospitals get the staffing levels up to the required level and do so as quickly as possible. And really, that is one of the most obvious things we have to do.
Well, not only would Sinn Féin lift the recruitment pause, but it is something that I have been demanding from government since they brought the recruitment pause in. It's crucifying the health service. It doesn't make any sense. It means that we don't have the staff to do those jobs that we need so very badly.
Any party who's saying they will increase capacity or tackle the overcrowding, it simply can't be done without increasing staff. And currently, like some of the recruitment processes I've heard about, they take 6 months. That's simply unworkable, and that's what needs to be tackled.
Lift the hiring embargo immediately. Prioritise recruitment. None of this 9 months to hire an emergency medicine nurse or doctor. Get rid of that. This is an emergency. Hire the nurses, hire the doctors. We're not at the agreed safe staffing levels. It's not safe in many emergency departments for patients, and it's not safe for the nurses and the doctors and the other healthcare professionals working in there.
So would your party immediately lift the recruitment embargo from nursing and midwifery?
So we will be very, very, very clear in relation to this. 5,000 more nurses.
So directors of nursing can have the authority to recruit
within the budget. So obviously there will be fully funded plans for 5,000 more nurses over the lifetime of the next government.
And the embargo would be lifted from the recruitment of those nurses.
And where there are fully funded posts, as there will be for 5,000, there will be absolutely no difficulty to recruiting. And what I want to work with the INMO, work with directors of nurses, listen to nurses and midwives as to how we can make that recruitment process easier.